Thank you very much for the invitation to speak here. It's an honor to speak at the EU. And I'm the lead of the Emergency and Essential Surgical Care Program, but my background is neurosurgery, so I'm bringing more of a surgical perspective, and particularly a neurosurgical perspective, to traumatic brain injury, but looking at a global perspective. 2015 was a banner year for global surgery. On the top right, the Essential Surgery, the first volume of Disease Control Priority put out by Gates and the World Bank, really developed in a very substantial way the health economics of surgical care. Lancet Commission on Global Surgery was put out, which really changed the paradigm of our understanding of the needs for surgical care and some of the health economics. From my perspective, the United Nations changed from Millennium Development Goals to the era of sustainable development, or the SDG era, fundamentally changed how we were looking. Our targets changed, what we wanted to do, going from 2015 to 2030 changed. And lastly, the World Health Assembly passed unanimously, every country on the planet approved and supported the resolution on strengthening emergency and essential surgical care and anesthesia as a component of universal health coverage. Universal health coverage is now the #1 priority of our new Director General. So looking at the SDGs, SDG 3, the goal 3 is on health. There's 8 different parts of those targets specifically for surgery, but if you look at traumatic brain injury, ending preventable deaths, TBI in young children is a very big deal. Have or cut by 50% global deaths and injuries from road traffic accidents. Ensure universal health coverage, which we just mentioned, including financial risk protection. And develop sufficient health workforce, surgeons, experts in traumatic brain injury, emergency and acute care personnel, etc. So some of the global facts on traumatic brain injury, it's really #1 or #2 lethal injury in every country. Increasing incidence of TBI reflects rises in road traffic accidents, violence, particularly in low and middle income country, which really bears the burden of about 90% of all TBI related deaths. At the moment, there's no resource stratified treatment algorithms, which means if you don't have a CT scan or an MRI scan out in district hospitals in sub-Africa, for example, there's no treatment algorithm for someone with a TBI. You don't know what to do. Everything, all evidence-based treatment algorithms are based on imaging. The incidents are 200 to 600, but that's an estimation. The precise global incidence is not well understood. Underdeveloped data collection systems, variation in methods, out-of-hospital deaths, which are a huge number, they're just not recorded, and lack of comprehensive studies in defined populations. Road traffic accidents, #1 cause of death in young people that just learned to drive and in the early stages of driving, kills 1.5 million people practically every year. 50% of these are pedestrians, people that don't see the vehicle coming, cyclists or motorcycles. And that incidence of road traffic accidents and TBI is predicted to go up. It's probably difficult to see this from a distance, but the top curves that are all going up, here we go. These are all for NCDs, cancer, ischemic heart disease, cerebral vascular disease, are all going up in every country. And this orange line down here is road traffic accidents, not going up quite as dramatically, but certainly going up over the next 15 years. Some of the risk factors, the #1 risk factor is powered two-wheel vehicles, motorcycles, mopeds, et cetera, particularly users that are not wearing helmets, which is most of low and middle income countries. Helmet wearing hovers about 0%, and often in children are put in between adults on the motorcycle. No one's wearing helmets. and there's sometimes 5 or 6 people in a row on the same motorcycle going down the street. Mandatory helmet laws have been shown to reduce TBI by approximately 40%. This data is a couple years old, but there's only 28 countries in this world, representing about 450 million people, 7% of the total population, that have adequate laws that cover the top 5 risks for death: speed, drink driving, helmets, seat belts, and child restraints. Only 7%. Particularly people my age and above, falls are becoming an increasing issue. Annually, more than 600,000 individuals worldwide die from falls. Many in OECD countries, those falls are also precipitated because of anticoagulation for heart disease or risk for strokes. The CDC in 2013, 80% of all TBI-related ED visits on people 65 and older were caused by falls. In low and middle income countries, we have no idea what the incidence of falls is because many are underreported. Either they die in the village and never make it to the hospital. And I have to put this in, my country, the US, is, I don't know if you've heard, is fascinated with weapons of many types, and the more the better. We have as many people, and my experience as a neurosurgeon, brains and bullets are a particularly bad combination. Bullets are very hard. They have a lot of kinetic energy. Brains are very soft. And in the US, we have as many firearm-related deaths as road traffic accidents, about 35,000 each. And it's adults, it's children, it's indiscriminate. It is something that many of us think clearly something needs to be done. If you've watched the news over just the last couple months, Las Vegas, Texas, it's madness. And the only measure that clearly reduces the incidence of firearm-related TBI is the availability of firearms, as Australia and the UK have shown. Firearms are probably one of the biggest reasons for death with TBI. It's a tragic accident. The inequities and injuries, you can see these brightly colored low and middle income countries bear the brunt of injury deaths in the world. And according to the disease control priority book that I showed earlier, of the 17 million avertable deaths every year that could be avertable with surgical care, 68% are due to injuries. If you look at what that looks like, this little guy on the left is all the deaths, which is about 3 million per year, of HIV, AIDS, TB, and malaria combined. If you look on the right, this guy is total surgical avertable deaths. If you had trained surgeons to operate on these people, you would save about 17 million per year. The reason I'm showing this slide is to highlight the fact that HIV, TB, and malaria, while I'm not minimizing that in the least, they have a global fund of approximately $5 billion US, that's with a B, per year, and surgical care, including the surgical care of TBIs, has no global fund, is really unfunded. One of the crucial issues with TBI is the initial care and the acute care. The pre-hospital emergency care, the scene of the injury, inpatient care, but also the post-acute care and the rehabilitation, which is almost non-existent in low and middle income countries. High-income countries, 85% of every hospital has some type of specialist emergency person on site to care for people acutely injured. In low and middle income countries, only 28 facilities have someone of the attending or consultant level working in them. And if you're looking for specially trained emergency physicians, only 4% of institutions have one of those people available 24 hours a day. If you look at just surgical care across the globe, 5 billion people do not have access to surgical care. That's including surgical care of TBI. You think, well, that's a huge number. 5 billion out of 7 is not very good. How did you approach that number? Well, if you look at a particular country that's based on access to care in a timely fashion, if you're bleeding to death and you can't get to the hospital for several days, you're not going to survive. If you get to the hospital and they say, well, sorry, we don't treat your kind of injury, you have to go to another hospital, you don't have access. If that hospital doesn't have the facility to provide safe care, you don't have access, and most importantly, including in the U.S., if you cannot afford that care, you don't get that care, and that is an issue with access. So these things of access on a timely basis, capacity, safety, and affordability are the issues that people do not have access to surgical care. So what can we do? Well, we need to implement best practice strategies aimed at all aspects of prevention, address the top 5 risk factors from a policy standpoint, and not only make people safe in their vehicles, but make roads and vehicles safe from each other. We need to develop resource stratified guidelines. So whatever your resources, whether you have a CT, you don't have a CT, you have some kind of an algorithm to treat these patients. We need to develop hospital capacity around the world. We need to develop training programs so people know how to treat acute care issues, surgical issues, and rehabilitation issues. Dr. Moss mentioned rehabilitation, and it is sadly just come on the radar of the WHO. This year, 2017, we had our very first conference, global conference on rehabilitation with about 300 people attending, but the very first rehabilitation conference held at WHO at all. But it's on the radar, and I expect more and more of that to be seen. Lastly, we need a concerted effort to reduce what's called the 1090 gap, where 10% of current global research funding goes towards diseases that afflict more than 90% of the global population. That's a big gap, and we need to change that. Thank you very much.